Okay, most of you probably would never think of the heart as a simple pump, but it really is. It is just a simple pump with four chambers. The physiology portion of it is really, really complicated, but as a pump, it is just a simple side-by-side, top and bottom pump. So the way it works is there's three circuits in the pump. One of them is the pulmonary circuit, and the other is the systemic circuit, and the other one is going to be the one where the blood gets pumped from the heart to the heart. And I'll explain that as we go along. So the heart is a transport system consisting of side-by-side pumps. So going back to our blood, in order to move the blood throughout the body, you're going to have a series of tubes, and the series of tubes are called arteries or veins. And in order to get it to go to every cell in the body, we're going to have the pump blood to every cell in the body. But what you have to learn is that there's two circuits. The right side is the pulmonary side, pulmonary side, and its job is consisting of pumping the blood to the lungs. Once the blood gets in the lungs, it's going to pick up oxygen, and then it's going to be pumped still from the heart, from the lungs to the left side of the heart. And that's going to be the systemic side of the heart. So a couple ways that I try to get you to understand that is, first of all, it's two pumps side by side, but there's also going to be a top and a bottom. The two top chambers are called the atria. And so they are the receiving chambers of the heart. They're the ones that are going to receive either deoxygenated blood or oxygenated blood. On the right side, they're getting all the blood that has dumped off its oxygen, and it's going to then go into the heart, pump it to the lungs so it picks up oxygen, and then send it to the left side of the heart and pump it to every part of the body. So you'll see this as I repeat it a couple of times. So the top atria are the receiving chambers, whether it's oxygenated or deoxygenating. They're just receiving it. The two ventricles are going to be the pumping chambers of the heart. So once the blood goes into the ventricle, it is going to either, on the right side, it'll be pumped to the lungs, and on the left side, it's going to be pumped throughout the whole body. So simply, as a four-chamber heart, you got two on the top, which are called the atria. You got two on the bottom, which are going to be called the ventricles. The ventricles are going to be the pumping portion of the heart. So this picture here kind of shows you in color how it goes from place to place to place. The right side of the heart that they're showing as blue is because it gets deoxygenated blood. Deoxygenated blood has to go to the lungs, and it picks up oxygen there, and then it sends it to the left side. The left side will send it throughout the whole body. So as long as you got the idea that every time that blood comes back to the heart, it has to do the right side, then go to the lungs, come to the left side, then it can go elsewhere. One of the things that I'll mention now is I am going to name a red blood cell, which sounds kind of strange, but I usually call them Ben. So when we finally get to the vessels, we're going to follow Ben from place to place to place. I've found over the years of teaching students, it makes sense to them. They can understand it once we put a name to it. I just picked Ben. There's no reason for that. So just keep that in mind. I will mention Ben coming and going from and to the heart. If you think about the heart, and if you make your own fist, the fist is about the size of your heart, and it weighs less than a pound. It is found in the center between the fifth and second rib in the intercostal space. It's in the mediastinum. It sits on top of the diaphragm, and it is also anterior to the spinal cord and, of course, posterior to the sternum. That puts it in a nice place if you have to have CPR done. You have something hard to push against, the sternum, and you have something rigid in the back that will allow you to pump blood through the heart. And here's a picture of how it kind of sits there in the ribs cage, which is protecting it behind the sternum and in front of the spinal cord. The apex is going to point down to your left hip, and it's basically where you would find the heart. The base is actually on the top. It points towards your right shoulder. The apex is the pointy part that's going to point towards your left hip. And the apical impulse is usually found just below your left nipple, and you can hear your heartbeat pretty good through there. Okay. The coverings of the heart are real important, and you have to go back to A&P1 to think about the pericardium. It is a double-walled sac that surrounds the heart, and it's made up of two layers. You just go to a picture to explain it. So if you look at this picture here, here is the heart itself. Here is the endocardium. That is going to be the covering of the muscle of the heart on the inside. So that's what would be the inside portion of the chamber. The myocardium is actually going to be the heart muscle itself. And then we're going to take the outer covering of the myocardium, and its name is epicardium, or it's called the visceral layer of the serous pericardium. So if you remember back to A&P1, we talked about visceral and parietal layers, and no one had any idea what we were talking about. And what I tried to explain that is, if you have saran wrap or glad wrap covering your heart, that would be considered the epicardium, or the visceral layer of the heart. Then what we're going to do is take that covering and flip it over. And what it's going to do then, that portion is called the parietal layer of the serous pericardium. It is going to be on the inside of the fibrous pericardium. So your heart actually sits in a sac. The outside of the heart is going to be one layer of saran wrap. Then we're going to flip it around and line the inside layer of the fibrous pericardium, or the sac, and it lives in there. By doing it and flipping it over, we're not using glad wrap, by the way, it gives us a little cavity. The pericardial cavity is a potential space, and it's going to be lined with serous fluid. So it's going to be super slippery in the sense that as your heart expands and contracts, you don't want to have your heart sticking to the inside of the saran wrap. As a matter of fact, if I go ahead one, where you have an inflammation of the pericardium, it gets a roughened area between the two pieces or two layers of membrane. And if you do have inflammation, it's called pericarditis, and the noise that you hear is a pericardial friction rub. It truly sounds like a creaking noise, lub-dub, every time you're doing a heartbeat. And from what I understand, it's kind of painful. Additionally, if you have fluid in that area, you're probably going to have to get the fluid drawn off in order not to have it floating in excessive fluid. So, as I mentioned before, the epicardium is the visceral layer covering the heart. The myocardium is actually the heart muscle itself, and the heart muscle itself kind of looks circular. So if you look at this picture, if you remember back to A&P1 when we looked at cardiac muscle, sometimes you would have an intercalated disc and sometimes you wouldn't. Even though the slide said it was cardiac muscle, the reason for that is if you look at these twisted bundles, I always think of this as wringing out a hand towel. You're going to contract and relax and contract and relax, and you're going to tighten up the hand towel so that these bundles are twisted a little bit. That's why sometimes you'll find an intercalated disc and sometimes you won't. It just depends on where the cut was made through the heart. The endocardium, as I mentioned earlier, is the innermost layer, and it is usually continuous with the endothelial lining of a blood vessel. I like to think of that as kind of like the Teflon layer. So you got a Teflon layer so the heart doesn't stick to the inside of your heart, and then that Teflon layer is going to be continuous with the vessels as they leave and go into the heart. So the endocardium is the innermost layer of the heart and also blood vessels when we get to that. Once again, here's that picture of the heart in cross section. You can see the heart chamber.
And in that one, it looks like it's the left atrium. The endocardium is going to be the inside layer, and then the myocardium is going to be the cardiac muscle. Then the epicardium is the visceral layer of that serous pericardium. Once again, if you think of it as saran wrap, you can flip it over, and then it's going to be the inside layer of the fibrous pericardium with a potential space in between them, which is called the pericardial cavity, which is going to have a serous fluid in it, which is going to make it really super slippery. Okay, some of the other things about the heart going and the vessels going into it. We have, as I mentioned before, 4 chambers, 2 atria, which are going to be the receiving chambers, and 2 ventricles, which are going to be the discharge chambers. We are going to have a septum between them. So in between the right atria and the left atria is going to be the intraatrial septum. It doesn't mean anything more than it separates to 2 atria, and most models don't even show it, but it does exist. The interventricular septum is something that most people have probably heard of, and it's going to separate the 2 ventricles. In the case of the intraatrial septum, it is the remnant of a leftover of the foramen ovale of a fetal heart. So what will happen at the baby's birth is that foramen ovale, because the baby is not breathing on its own, you are mixing oxygenated and deoxygenated blood together, and it is going to trickle from one side to the other, and the hole there is called the foramen ovale. It's going to close up, hopefully, and it becomes a scar tissue, which is going to be on the atrial wall called the fossa ovalis. So here is an actual picture of a cross-section through the heart. I am going to show that because that's a much better picture than the drawing that I'm going to go over, and I'm going to go to the whiteboard to explain that. I'll go back to that one. So on my picture here, I have the right atrium and the left atrium, and they are going to be on the top of the heart, and then we're going to have the right ventricle and the left ventricle, okay? There are going to be 3 vessels that are going to bring deoxygenated blood into the right atrium. So coming from here down is going to be the superior vena cava. Coming from here up is going to be the inferior vena cava. So those are 2 of the 3. The third one is going to be the coronary sinus, which will be somewhere over here. So we'll just make this coronary sinus. I actually do draw like that. So there's 3 vessels that are going to bring blood to the right atrium. Remember, that is the chamber that's going to receive deoxygenated blood. So that's what they've done. They brought anything below the diaphragm is going to come through the inferior vena cava. Anything above the diaphragm is going to be the superior vena cava. It's going to bring it in. And then anything that's going into the heart muscle is going to go into the right atrium through the coronary sinus. Okay, so this chamber has 3 vessels that you can see over here: inferior vena cava, superior vena cava, and they're not really showing the coronary sinus, which is actually on the back of the heart. Then we're going to have between the atria and the ventricles a one-way valve. The way to remember this, and the way that I always remember this, someone once told me you want to try it before you buy it. So on this one here, there's going to be 3 cusps. This is the tricuspid valve. And the tricuspid valve is a atrial ventricular valve. So the deoxygenated blood is going to go into the right atrium, go through the tricuspid valve, into the right ventricle, and then from the right ventricle, it's going to go through another valve. Here's where the drawing gets pretty ugly. So as I'm drawing it through here, it's going to leave here, and it's going to go into something called the pulmonary trunk. And then the pulmonary trunk, as you see it here, which is much better than mine, will go into the pulmonary artery, left pulmonary, and the right pulmonary artery. So off of this trunk, we are going to go over to here, and we're going to go over to here. These are actually going to be vessels. So from the trunk, we're going to go into this. And I'm just going to draw it this way, and here's a lung over here. Okay?
So that takes care of the right side. Deoxygenated blood is going into the right atrium, a receiving chamber, through the superior vena cava, the inferior vena cava, and the coronary sinus. Once that blood gets into that chamber, it's got to go into the right ventricle through the tricuspid valve, and then it's got to go into the pulmonary valve, or into the pulmonary trunk. The pulmonary trunk has a unique way of having the valve here, and it's going to be the pulmonary valve. Now, and it used to be called the pulmonary semilunar valve. Semilunar means that's the shape. So if you look at the shape here, and the shape over here is much better, as you pump blood into the lungs, some of it's going to drip down. And as it drips down, it's going to close those two valves. Kind of a nice setup. So we're going to go into the pulmonary trunk, into the pulmonary artery. And then we're going to go into the left lung, and then on the other side would be the right lung. Okay. Then after it picks up the oxygen, so I'm going to now talk about Ben. So Ben has come from someplace. Let's say he was down at the little toe. Ben has to come through the inferior vena cava into the right atrium. Ben has to go through the tricuspid valve into the right ventricle. Then he has to go through the pulmonary valve, into the pulmonary trunk, into the pulmonary arteries, into the lung. Now Ben there all of a sudden picks up oxygen. So I'm just going to refer to him as Super Ben. So once Ben is all supercharged with oxygen, he has to get back to the other side of the heart, which will be the left side. And so after he goes into the lung, he is then going to go into a pulmonary vein. And the pulmonary vein, and there's going to be 4 of them, 2 on the left side, 2 on the right side, they're going to bring their blood back to the right atrium. So one of the things I'm going to do is make this wall a lot thicker here, because if you think about where your heart is versus your lungs, it's just a couple inches from side to side. And so Ben made it to the right ventricle, made it to the pulmonary trunk, pulmonary artery, lung. He picks up oxygen. He is now coming back to the left atrium, where, once again, that is a receiving chamber. In this particular case, Ben is now oxygenated. Once he gets into here, he has to go through this valve, which is called the bicuspid valve, but it's also called the mitral valve. Most people probably have heard it from that. So once Ben has made it through the lungs, into the receiving chamber, through the bicuspid valve, into the left ventricle, he then has to go through, I'm going to draw my little picture here. Here is going to be another one-way valve. This is called the aortic valve. And so once Ben gets from here into the aorta, he has to go, and you can kind of see it, here's the aortic valve. He is going to go up. And then he's going to go up and around. So once he gets up and around, this is called the ascending aorta. This is called the arch of the aorta. And then this is going to be the descending aorta. We'll go over all of those when we go through the vessels and stuff like that. So for right now, be able to follow Ben into the heart, around the heart, and then out of the heart. And this particular book actually puts it together in a flow chart. That's the easiest way to try and learn this. And so as I get to it, and I'll go through all of these parts in a few seconds. Here is the flow of blood into the heart. So however or wherever Ben has been, he is going to either come to the right atrium, which is the right side of the heart, through the superior vena cava, the inferior vena cava, or the coronary sinus, depending on where it was. He then has to go into the right atrium through a one-way valve. If for some reason that one-way valve is not working, you may hear a murmur, and that is one of the problems with the valves didn't close
correctly, or they're kind of too rigid or something like that. So right atrium goes into the tricuspid valve, which will go into the right ventricle. Remember, the ventricles are the discharge chambers, which has to go into a one-way valve. So in this particular one, they list it as the pulmonary semilunar valves. Some other books will just say pulmonary valve. Once you go through the valve, you have to go into a trunk. And then from the trunk, it'll go into the pulmonary arteries, and then it will go into the lungs. So the flow chart, in order to learn this in the beginning, is pretty simple. Once Ben has made it into the lungs, he is picking up oxygen. He's dumping off his carbon dioxide, and your respiration system will take care of exhaling it out. But in order for him to pick up his oxygen, he has to get into the lungs. On the left side, so once Ben has got into the lungs, whether it's the right side or the left side, he is then going to leave the lungs and go back to the left side of the heart through a pulmonary vein. By definition, arteries take blood to the heart and veins take blood away from the heart. Then, once he gets into the pulmonary vein, he is going to go into the left atrium. He has to go through another one-way valve. In this case, it's an atrioventricular valve, and its name is either going to be the bicuspid, meaning it has two cusps on it, or the mitral valve. Then it's going to get into the left ventricle, and that is a discharge chamber. And then once again, he is going to have to pump out of through a valve, which is the aortic semilunar valve, into the aorta. And then specifically, it would be the ascending aorta, and then it would go into systemic circulation. So that's something that you should, here's kind of the pictures of showing where it's going, but all books have similar pictures. There's even pictures on YouTube of